make it possible for people across the world to face a huge problem which the majority of the people faces a serious consequences. The word cancer was a death sentence before. I'm happy with the clinical expertise that has come into think that what are here. So there are wonderful surgeries. Many of them have been cured or constituted. But I think what's most important is the advances that are taken, the major research programs that are happening, and made a significant impact. From last 3 decades we have seen what a poor across the country is a clinical excellence in almost every single discipline. Being a cardiologist, I can proudly say that today in India we do the cardiac surgeries, cardiac procedures, and cardiac surgery equivalent to the best centers anywhere in the world. So similarly, in almost all of the departments, the clinical expertise have tremendously made a significant impact in various good hospitals across the nation. But what's most important is, this decade has been threatened by way back in the mid 2015, 2016, IMF World Economic Forum warned, saying the non-communicable diseases are going to be the major threat for this decade. At the end of the decade, 80% of the deaths will be from non-communicable diseases, and the cost burden for that is going to be $4 trillion for the world, and 30 trillion for the world, 4 trillion for India. What is 4 trillion for India? Well, at that time, it's going to be 50% of GDP. You know how we are struggling to bring from 1 to 3% of the GDP to our healthcare budget. Leave it on the budget. But what are these non-communicable diseases? The heart attacks. The heart attack is not like the heart attacks in the West. Heart attacks in the West occur in the ages of the 60s and 80s. But in India, it used to occur between 35 and 50. Now we are seeing that heart attack between 25 and 35. I'm sure you all are aware. The last time, 7 months ago, last 27-year-old who couldn't reach the hospital earlier enough. So we made all our ambulances 1066 for all medical and surgical emergencies, absolutely free. Because our ambulances today have used this 5G technology, connected technology, so that treatment starts at home. So I think this is where the technology has made a significant impact. This is where we are very happy today to have Dr. Datar, who have made a great impact in the last 15 years. In the last 15 years, he has made a significant impact in genetic research. Genetic research which has brought into practicality. We have been the very first to have been associated with him earlier in all our checkups and made a significant impact. But today's second is a brilliant one. It's a marvelous gift for any lady, because the breast cancers, amongst all the non-communicable diseases, the cancers are the worst. They are growing at the rate of 10 to 15%, and they are increasing each year. Whatever the incidence is, for that lady, it's a terrible thing to hear that you have a breast cancer. And the prognosis before was very serious. But now I think if you can diagnose a disease early, especially cancer, it's a most curable disease. So the diagnosis is very important. This is where I think today marks another major milestone in the history of Apollo, history of healthcare of India, in bringing the easy test for detecting breast cancers with a simple blood test. Please remember this. With a simple blood test, you can detect breast cancer at the earliest stage. And if you detect it early, surgeons like Dr. Bandar will find it very easy to remove it and the patient is absolutely cured. So I think I must compliment Datar Genetics who have done this. It is not, we are not first in India. He has already taken it and got an FDA approval. He has about 15 countries across the world, probably he'll explain a little more on that. 15 countries, they are already doing it in UK, US, and other European countries. But in India, we have an exclusive arrangement with Datar. We will do for all our patients. In many of our centers, we have already got plenty of centers. We will open more centers so that we can make this early diagnosis. You all know that we are the first in the world to have started a health checkup program called the Mass Health Checkup. Today, that Mass Health Checkup using artificial intelligence, we have made it as a Pro Health. Pro Health detects your one-time total body health status and the various risk factors. This will be in part of the Pro Health also. Even if they want a complete checkup, EasyCheck will be part of the program. So the patient will have that benefit of knowing, number one, I don't have breast cancer. That answer is a very wonderful to see. Or even if you have breast cancer, the surgeon immediately is going to say, I'm happy it got detected so that you can remove it and you can lead a normal life. See, these two words are going to make a significant impact. That is what today we are able to offer thanks to Datar Genetics. We are able to offer for people across the country. Not only across the country, we'll take to other places wherever we are in other parts of the world. Yesterday, as you all know, we signed with Bangladesh. It will be available for people in Bangladesh. And similarly in other countries, wherever we are already there, where we will be there, we will be able to take. So this is the arrangement that we have with Datar. But please remember that people must remember saying they are aware of many things. They have done a number of programs, but they are not aware that their body also needs to know what their status is. So this is where we are very keen that the media players should play a significant role for India to be healthy, happy and wealthy. First they must know, every individual must know what is their state of health. Usually the breast cancers are across the world, they say it is around 40 and around. Dr. Bandari probably will say, no, in India it occurs a little earlier. So whatever that is, I think if a lady has a test at 35 or 40, if she has a test and knows that the test is negative, she could be happy that there is no breast cancer. I think it's a very wonderful thing that we're able to offer this token of good health for people across the nation and probably where, as I said, at all places where we couldn't have done this but for the great research work that Datar Genetics have done. And it's no longer the research. As I said, it's already available. Datar Genetics have already introduced it in other countries. And in India, we are partnered with them so that we'll have this facility available for our people all over the country where we are already present, and we'll open more centers so that we'll be able to do the test for the women to detect through this EasyCheck method. Please remember the word EasyCheck. That is the name of the test which will detect that an individual has no cancer, or if cancer is detected early so that we can treat and make it normal. So, all that I can say is our President Dinesh Madhavan has huge plans. He brought this program together, but he has many he has rolled out. As we are talking now, if somebody walks into one of our centers tomorrow morning, the test will be available for them. So he has a complete program of the centers that will be able to do it now, the centers that will open more centers, so that our ambition is to detect disease early, especially cancer detected early is a cure. I have great confidence for all of you who are taking this good news to people, saying, please have a check done. You know, sometimes people think, oh, is the test expensive? You know, first you must all think that health expenditure is an investment, it is not an expenditure. It is an investment into your good health. So please don't bother about the cost of the test, but I think see the great value that it will add for human life. And human life not only for the individual, for the whole family's happiness. So I think by doing these tests, I think you are bringing in another major element in bringing happiness into the family. God bless all of you. We are here, as you all know, in the last 3 decades, we brought whatever is available anywhere in the world. And I can assure you, we'll continuously do. Because in clinically we have done whatever possible anywhere. But what we have done in the last 1 year is to be able to bring artificial intelligence, datamatics, robotics, 3D printing in Hyderabad, all these new advances which can make people more healthy and give precision therapy for people. This is the byword for that we will always give the precision therapy for all people who approach us and the ability to diagnose disease early. God bless.
I want to start by saying that breast cancer is touching so many women today worldwide that it is no longer a problem which can be wished away. Many women are being detected with breast cancer much earlier in their life than they were before. The age at which cancer was detected over the years was 45 to 50. Today that age has now come down to around 30 years or so. Presently, mammography is used as a standard of care for detection of breast cancer. In many countries, in India it is used as a recommendation, but not yet widely adopted. This has led to a situation where it may be perceived as being a cancer detection test. It is a good news test because we give the bad news early enough to be rectified. The test has been validated in more than 40,000 individuals as part of a large clinical trial. And the accuracy has been outstanding at about 99%, with virtually no false positives, which means that we don't detect or we don't say that somebody has cancer when actually nobody has cancer. This is a very important part because mammography today has poor specificity, which means that many women are detected with a suspicious finding on the mammography, leading to more tests and more investigations, which oftentimes are found to be realized. The test works on the detection of circulating tumor cells, which are released by tumors and are very rare in the normal blood cells, which are usually found in the blood and are extremely difficult to detect. I am very proud to say that we have developed this test in India with the effort of Indian scientists and equipment and intelligence, where we are the world's best test available today, And again, I am very proud to say that the test is available across 20 countries in Europe, in the United States, as well as in India. We are privileged to be associated with Apollo Hospitals and the Apollo Group, that this test is now being made available to women in India at a very affordable cost, and it will be our pleasure to expand this portfolio to other tests as well for other cancers where we want to upstage, we want to bring the stage of the detection of the disease as early as possible, from the present stage 3 to 4 to stage 1 and 2 as far as possible. Incidentally, I may mention that the United Kingdom has made it a policy decision that the detection of cancers in that country should be brought down at stage 1 and 2 to 70% of all cancers detected by 2030. We are attempting to do a similar thing in India, and we encourage more and more women to take this test, at least to begin with, so that the breast cancer incidence can be curtailed by early detection and cure. We wish to expand this, as I mentioned, to other cancers, colon cancer, lung cancer, prostate cancer, and so on, as we move forward. And it will be our endeavor to make these tests available to the Indian population at very reasonable rates, so that most people in the country can have the cancer detected early and have interventions at the earliest possible time. To conclude, I can say that as an Indian company, it is a matter of immense pride that we are the world's best test for detection of breast cancer today anywhere in the world, and we will continue to strive to put India on the map of the world for this cutting-edge technology. I thank Dr. Reddy for his continued blessings and guidance, and the Apollo Group for their support, and I look forward to be of more help and more assistance to the Indian population. Thank you very much.
It's my honor and privilege to present a few excerpts from the EasyCheck trial and the study, so as to make you understand this in simple language. So moving on, I would not bother you with the statistics. We know breast cancers are growing at an alarming rate, and these are the highest, the incidence of breast cancers is the highest among all cancers in females. And it's our responsibility as a healthcare conscious, health professionals to curb this disease, which is called deadly, and we do not want to call it deadly anymore. Let us accept it. Let us try to curb that fear from the woman and come forward to get her test or the screening test done. So just to allude to some of the data here, if you can look at the Western statistics to the left, you can see that the deaths are not as many as compared to the incidence of breast cancer. Whereas India, if you see, it's nearly 50%. These are Globocan statistics and not our data. And to the right, again, if you could see, in India, we pick up cancers in the later stages, generally the stage 3 and stage 4, as opposed to the Western world, where screening solutions are robust. There are screening programs, and they are picking up early, so they can conquer cancer earlier. And it is our responsibility now to increase this segment, which is trying to pick up cancers, as our Reverend Chairman Sir has spoken, in the early stages itself. And also, if you could look at the graph below, the mortality is much lesser. You can conquer when it is at an early stage, what we call the stage 0 or the duct carcinoma in situ, that is before it has invaded. So either at stage 0 or stage 1. These are the situations where we need to capture and pick up patients to conquer this disease. So just to give a perspective, this is the IARC data from the World Health Organization. In 2020, 500,000 women in the low and middle income countries have died of breast cancer. Isn't that really disturbing? Should we not do our bit to curb this kind of thing? So these are, as has been extensively discussed, these are the common modalities that we use for screening and detection. They are generally, we recommend breast self-examination by the individual herself, clinical breast examination. We also recommend screening mammograms and sonomammography. But we all know there are challenges. One, because patients are not very much aware, they would not come for the test because of the fear of radiation pain associated with mammography. So it is essential that we find something which is non-invasive based on a simple blood test, and this is what we at Apollo and Datar Cancer Genetics are doing. So this is the problem statement. There is an urgent unmet medical need for a screening test with high sensitivity to detect early stage breast cancers at a reasonable cost and be accessible. So please remember, this sample can be collected from any corner of the country. It doesn't need that the patient come to a tier 1 city. And this is where the technology is moving. So EasyCheck Breast is a simple blood test for screening of early stage breast cancers in asymptomatic. Please note this. This is in normal individuals like me and you. So these are in asymptomatic women based on the detection of breast cancer specific circulating tumor cells. As Mr. Rajan Datar had just alluded to, CTCs are not seen in normal individuals or benign conditions. Circulating tumor cells are only seen in malignancies, and this is the principle on which EasyCheck is based. So we need only 5 ml, and it can be a draw at the convenience of the individual's office or home. Just to give you a simple perspective of the test, this is the blood sample that has been collected. Circulating tumor cells are isolated, and then these are stained with what is called a multiplex fluorescence immunocytochemistry. And these are profiled, and then we say, yes, breast cancer specific cells are there, tumor cells are there in the blood or not there. That is all the report says. We do not talk about anything, whether it is positive or negative. And thereafter, the breast oncologist would be taking it up with the standard of care tests that are recommended as per guidelines. Why EasyCheck Breast? Because it enables early and accurate detection. It is a non-invasive test. As I told you, it only needs 5 ml of peripheral blood. The test has very high sensitivity, 88.2%, and it is much better than the established techniques. But please note, these are all complementary tools. All of us know that no single test is absolutely perfect, but these do help. Specificity more than 99%, and accuracy, that is, it picks where an individual has malignancy or the individual doesn't have malignancy, to the tune of more than 99%. So the trial also showed that the CTCs, or the so-called circulating tumor cells, can be detected in more than 80% of stage 0 cases and more than 90% of stage 1 cases. So it is not only in the advanced cases wherein it is in the stage 3 and 4, it is to the tune of 95 to 100%, because obviously more circulating tumor cells are shed into the circulation. But it is the benefit is that it's also picked up in the very early stages. It is recommended for asymptomatic women who are aged more than 40 years, and also when the individuals come out, there is a report of a positive finding, they have to reach out to the breast oncologist or physician for further care. So as Sir had just alluded to, Trinetra was the first FDA breakthrough device for early stage breast cancer. This is how it's marketed in the US. And these are the accreditations and recognitions of Datar Cancer Genetics. We are CAP, CLIA certified, NABL accredited. These solutions are CE marked in the Europe, and also in the US, the US FDA breakthrough designation status has been obtained. So EasyCheck, please remember, does not aim to replace any standard of care screening methods, but it's a tool to triage your patients or individuals so as to take up the case for further testing. It only aims to reach out to more women who do not come for screening, which is a common situation in our country. So my humble appeal to the print and electronic media, for Manavi, please, మీ అందరూ circlesలో please create that awareness that any woman has to get herself checked annually get herself checked for breast cancer screening, which is the commonest cancer, and we can fight this deadly disease with very good results. Thank you for a patient hearing.
See, breast cancer is the commonest cancer among women as of now. It accounts for nearly 13% of all cancers in India, men and women combined. If you take women alone, it is about 26%. 26% for our population is a very high figure, accounting for nearly 1,80,000 cases per year. All women are destined to get breast cancer at some point in their life, provided they live to 90 to 100 years. As of now, they say that 1 in 22 women will get breast cancer, but the probability of it is that most of them are going to get it till they cross 90 or 100. So now the important thing here is, how do we treat breast cancer? Because breast cancer is going to happen in women. The only important thing here is we need to catch breast cancer at a very, very early stage. As we all know, only 10% of breast cancers are hereditary. Only 10%. And as of now, they are detected by using two genes known as BRCA1 and BRCA2. So, patients with family history of breast cancer, you can diagnose them early. Their chances of getting breast cancer by doing those two gene tests, BRCA1 and BRCA2. But what about the 90% of the patients who are likely to get breast cancer? Now, in this scenario, we have what is known as early screening tools, part of the screening checkup, as we have at Apollo Breast Cancer Clinics and all those kind of things, with mammogram, MRIs, and we have a standard protocol of doing all these tests after the women reach the age of 40 years, where there is no family history of breast cancer. And in cancer survivors and family history of breast cancer, we do them at an early age of about 35 years. So mammogram will be able to catch a lesion which is about 2 to 3 millimeters in size on a screening protocol. And the earliest a woman can feel a lump in the breast is at 1 centimeter. So a woman can only feel a lump in the breast if it is 1 centimeter in size, certainly not before that. A 1 centimeter size lesion in the breast contains 1 million cancer cells. Yes, 1 centimeter size breast lump contains 1 million cancer cells. And these cancer cells very soon get out of the lump and they start circulating. That's why breast cancer is a very dangerous disease, because it is a systemic disease right from the time of inception. So the important thing here is, apart from catching breast cancer with mammogram at an early stage, stage 1, it is even more important to catch breast cancer at stage 0. Meaning to say, before the cancer becomes invasive. And there is a terminology, I will not bother you with that. It's a pathological terminology where we call in situ cancer, stage 0. Even before it is going into the ducts and has started proliferating and has gone into the blood vessels. So EasyCheck is one of those technologies which is going to enable us to catch cancer at stage 0. It's very, very important if we are able to catch cancer at stage 0, because apart from catching cancer so early, it will lead to nearly 100% cure rates, one. Second thing, what it can do is, the costly treatment protocols when we catch cancer at stage 1 or 2, chemotherapy, radiation therapy, immunotherapy, all those things can be avoided if we catch the cancer at stage 0. So EasyCheck, in all probability, in conjunction with the other screening tools, is going to help us to catch cancer at an extremely early stage, what we call as stage 0. And this will definitely translate into very, very high cure rates, reaching 90 to 95% or even more than that in future. And maybe with easy accessibility of all these tools, we may be able to eradicate breast cancer in the near future. Because as I told you, breast cancer is going to happen to a woman depending upon which stage in life she is. So it's very, very important to catch it early and eradicate it. Thank you.
Collaboration is between Apollo Hospitals and Datar Genetics. A small correction there. Dignitaries on the dais are below chairman, Mr. Rajan Datar, who are known for a long time, a remarkable person who's trying to change and bring in a paradigm shift in the way the world looks at cancer from the eyes of India. Mr. Subramurthy, Dr. Bandari, an exemplary clinician, members of the media in this August gathering. You have heard what is the magnitude of the problem. And the reason we are here collaboratively is to find solutions. I'm just going to pick up on 3 subject matters which I believe the media here could disseminate to policymakers to make a difference. First, in the state that we are in the city, cancer is not a notifiable disease. Can we change that so that every time somebody gets diagnosed and every time somebody is being treated or somebody dies of cancer, it gets notified? Because the numbers which you saw is probably just the tip of the iceberg. The magnitude of the problem for a country like India, which does not document much, reports less, and notifies even less, could be multifold than what it is. Because if you do not know what is the actual quantum of people who are dying of disease or living through the disease or trying to battle cancer, you would not probably take it as seriously as an Apollo or Datar Genetics today is trying to find a solution, because you need to have more people at the policy level to make it notifiable. A couple of states in India have made cancer a notifiable disease, but a small number of it, and we have seen very evidently the changes which is taking place in those states. So I request the media first to see if we could create, through your media, a way to engage with policymakers in the state to create a bill or a pass to make cancer as a notifiable disease. That itself will be a huge step in creating the groundwork of what could be the future of the way cancer should be seen, the way it should be reviewed, the way it should be worked with people like Apollo, Datar, many others. They are very eminent clinicians in very reputable hospitals. Second, why are we going to see deaths here in this country for breast cancer? Because of the lack of a convenient way of doing the test. Because it's a little bit more cumbersome than what is available today through this landmark test which we have come together. True to its name, it's an EasyCheck where through a 5 ml blood sample, you're going to probably nip it in the bud, and that the power to fight or the power to battle cancer starts from there. You need to take the first step. Third, while you might have the best of technologies, exemplary clinicians like Dr. Bandari, oncopathologists like Dr. Sudha, but if you do not get yourself diagnosed early from cancer, you probably might have a less chance of winning over cancer. Probably tomorrow or in the future there'll be a vaccine for cancer, but today the only mantra is earlier it's easier, and it's probably the first step you have to take, and that's probably the only protection you have against winning over cancer or losing to cancer. And I urge the media here to view it from that perspective and see what best you can do so it reaches far and wide. We have created a platform to make it accessible. Like the earlier speakers mentioned, it could be out of your office, it could be out of home, it could be as convenient as it could be. It couldn't be better than that. Thank you so much for supporting this. Thank you.